today we'll be talking about hemostasis with Jake Riegel, Leo Donnelly, and Mitchell Dignan. All right, the first phase is the vascular phase, and in this, the essential aspect is the vascular spasm, which happens right away after damage happens upon the tissue. So your endothelial tissue is lined with smooth muscle fibers that will contract during this to mechanically prevent any bleeding to happen. And endothelins are released by the endothelial cells, and endothelins are essentially compounds or chemical agents and hormones that promote smooth muscle contraction as well as stimulate division of endothelial cells to try to repair the hole that has been made, and also smooth muscle cells and fibroblasts. And this is when the platelets adhere to the damaged tissue and they begin to aggregate, creating a platelet plug, which mechanically blocks a hole that has been created in the vessel wall. And then the platelets will create chemical agents that will help to support the healing process. The first one is adenosine diphosphate, and then the second one is thromboxane A2, serotonin, then clotting factors, then PDGF. And PDGF is simply just a platelet-derived growth factor, which helps repair the damaged tissue, and then calcium ions. And these three right here, calcium ions and ADP, adenosine diphosphate, and thromboxane A2, serotonin, have a positive feedback with one another. So they stimulate right here vascular spasm and then the contraction, and then this supplies them with enough molecules for the cascade to continue the healing process going.
All right, so next is the coagulation phase. This kind of occurs about 30 seconds after the injury has started. There are two pathways that all lead to the common pathway, and it's quite a complex just form of events. So the extrinsic pathway is going to begin with factor 3. The extrinsic pathway begins in outside or external of the bloodstream or blood vessels. So factor 3 is also known as tissue factor, which is released by endothelial cells in the vascular phase. It'll combine with calcium, and also later on in this pathway, it'll combine with factor 7, that should be 7. Once those all combine, it'll be able to become an enzyme complex, which can activate factor X, which that's always the end goal for these two. And then there's the intrinsic pathway. This one is inside of the bloodstream, which it begins with factor 12, should be factor 12. So what happens is factor 12 will sense or be stimulated by and become activated by collagen fibers, and then PF3 will combine with factor 12 as well as calcium, and later on factor 8 and 9, and once those all come together, it'll become another enzyme complex that can activate factor X. So all of these factors are clotting factors, which aid in the clotting response, and they're typically proenzymes, so they must be activated before they become an actual enzyme to be doing catalytic work and other things. But once you hit factor X, either way, both pathways lead to factor X into the common pathway. Factor X can activate a prothrombin activator, which basically turns prothrombin into thrombin, and thrombin is very important because this is what actually does the clotting. So fibrinogen, which is a protein in the blood plasma, will be converted into fibrin due to thrombin, and fibrin is what does all of the clotting. So those are all the pathways. There are some interactions, and the common pathway, this is a positive feedback regulation. So the common pathway will stimulate tissue factor formation in the extrinsic pathway, and it will stimulate PF3 release in the intrinsic pathway, which will just keep going with this cycle.
Final part is the fibrinolysis, which is the breakdown of the fibrin molecules at the site of the clot. So the enzymes thrombin and plasminogen activator enzyme that are present at the site activate the proenzyme plasminogen, which then produces the enzyme plasmin, which begins to digest the fibrin and break down the clot so that it doesn't grow and get out of hand. And this whole process is a balancing act with making sure that the wound is healed and also making sure that you break down all of the fibrin by the end. And then hopefully you're healed.